Today's topic is going to be about emergency rooms, urgent care centers, and what the difference is. Have you ever had a family member, or maybe you've gone to an urgent care center and found out that they're not the place to be at because you need to be at a emergency room that has a different type of level of treatment? Well, today we're going to define those, so stay tuned and listen.
Welcome, everybody, to another edition of Everyday Health Hacker Podcast. I'm Mike Herzing, and this young lady next to me is Dr. Lisa Liao.
Hi, Mike. How are you?
I am Austin, and I am really excited to learn today a lot about emergency rooms. Folks, our mission here is to give you some information so you can make informed choices for your health care. And this is a big one because I have not a clue on this thing. And it's one of those, this is one of those mysteries of the universe, kind of like UFOs. Or
Do
UAPs
they exist?
is what they call them now.
Yes.
Emergency rooms. People go to the emergency room and they're like, well, they don't take care of this.
Yes.
They only do, bobos. This is worse than that.
Yes.
I've got a broken arm, or we've got a heart attack. Of course, you waste this time going, but there's urgent care, there's non-urgent care, there's ER.
Intermediate care.
All right, what is this?
Saving
grandma's
intervention care.
Whatever. What is
Yes.
this?
So that's what we're going to talk about today, and have a definition so that you know what place you need to go to, and also maybe if you have insurance, to talk to your advocate at your insurance company. A lot of people have either an advocate or maybe they have a case manager, to know that if you were to need an emergency life-saving emergency room, which one would you go to? Because not all hospitals are contracted with every insurance.
Right.
So that can also be a quandary. Now, it's really important that if you are in a time where it's a stroke, it's a heart attack, something that is life-changing and immediate access to care is needed, these are level 1 emergency care centers, and these are going to be attached to a big hospital system. They're going to have an ICU as part of that hospital system, so it's really important. If it's a freestanding, not all freestanding ERs are level 1. There are a few that have small hospitals that can, but they might not have maybe stroke treatment there because a neurologist may not be there 24/7. They may be able to handle it, but they're going to get you to that next care. And what I do love about what I'd call those mid-levels, or let's call that level 2 emergency level care, is they have direct admission into the immediate life-threatening care. So that's really important to know. Here in Houston, largest medical center in the world, we have multiple hospitals, Methodist, Memorial, Women's Center, all of these places. And, if an easy way to think about it is that if you have life flight or a helicopter that can land on the building, that's going to be a level 1 emergency center. So an easy way to kind of define that.
Okay.
Then as you're driving down maybe your Main Street, the highway, and you see urgent care, after hours care, emergency room, how do you know the difference? Because not all of them even accept ambulances to go there. It's really something that you walk into.
Okay.
So it's important to define, is that something that you go to? Again, urgent care is going to be maybe something where you need stitches, something where
maybe.
something that's really basic, needing antibiotics for an upper respiratory infection, urinary tract infection, something that's very simple, but however, maybe your doctor is not on call. For us, we're on call 24/7. There's always somebody there to answer your messages. So that goes to all of us. So that's really important to know. If your doctor is not available, what urgent care should you go to for something that's minor? And if it's chest pain, I always share with patients, they're like, oh, it's just a panic attack. It might be just a panic attack, but it's really important that you're assessed completely with not just an EKG. There's something that's called a D-dimer test, where they take your blood and they find out if different blood levels are changing, which lets us know that you're having a heart attack. Because heart attacks can actually be silent, especially with women. Women can many times not have chest pain. They might have jaw pain, or they just don't feel good, and they may not even see anything until they go to the cath lab. So not every emergency room is going to have a cath lab, but if you see that a helicopter can land on that building, I promise you they have a cath lab at that hospital.
Oh, okay. Because I've had people say, my insurance company said I should have gone to urgent care instead of an emergency room because I only needed the stitches and I have to pay because it's cost more than this.
Correct.
And I'm like,
How would you know
how
that?
would you know that?
How
I
would
mean,
you
come
know
on,
that?
give me a break.
So it is important to read your pamphlets. Hopefully, if you're at a major corporation, hopefully they go through it with a brown bag luncheon and they go through, here are your benefits. This is the hospital that you should go to. If you need urgent care, this is where you should go to. Or you can just ask. Here in our area, I like to send everybody to St. Michael's because they do have a small hospital that's there. So for things and I'm going to call it like cellulitis, that's IV antibiotics. Maybe you need to do that for 3 days and you have to be hospitalized. Well, that's something that we would do until we switched you to home therapy or come into the office for IV therapy for antibiotics, because we do that here. Second is that maybe it's just a sore throat that your grandchildren are visiting and they need to
Sure.
see a doctor, but their pediatrician is in another state and they can't get a hold of them. Well, an urgent care center, which is usually just down the neighborhood in most places, we see that here in our Houston area. There's several of them. So that's non-urgent. That's going to be that sore throat, maybe that earache. That's going to be a level 5. A semi-urgent might be something that's a broken bone and when I say a broken bone, there can be different factors of a broken bone. If you see part of that bone, then that needs to go
Yeah,
to
if
an
it's sticking
emergent
out,
facility.
yeah, that's a problem.
If you see a bend in it and you're not really sure if you sprained it, that can usually go to a level 2 or a level 3. Emergency level center to where they can at least splint it until you can get into the orthopedics office.
Right.
So kind of the way I explain it to my patients is that if the doctor's office was open, you would go to your regular doctor, then that would be an urgent care level 5 or 4 center. If it's chest pain, a major burn of more than 20%, if it is a concern where you're not able to verbalize or there's a change and we're concerned about a stroke, then those are all level 1 centers. So if that helicopter's landing on that facility, that's where you need to go.
Okay, so otherwise, maybe when we're driving around our neighborhoods, on the way home, kind of pay attention and go, okay, is that, say, level 1, 2, or 3? I'll just kind of keep that in the back of my mind.
Absolutely.
So if something bad happens, I'll know where to go.
Yes.
That's the hot setup, right?
And the key is that you want to be at a place where there is people that can get you to that next level. So let's
Sure.
say that you do go to an urgent care and you're having a heart attack that you just thought was anxiety. They're going to transfer you. They
Right.
have admitting privileges to get you right in there. The phone calls, the difference is that they're not going to allow you to go in your car. You're going to go in an ambulance so that if you needed supportive care, you've got a better chance being in that ambulance.
Sure. But I mean, for a cut, or, I had a friend of mine kind of saw the end of his thumb
Yes.
off, and he was like, went to a place, he goes, well, we can't take care of that. Won't we sit? So they sent him to somebody else.
Right.
And then it was okay, but he just had it bleeding.
Yes.
They kind of covered him up and said, banded him up, said, all right, you need to go over here.
Right,
And
because
they did that.
sometimes there's a ligament that may be detached, and
Sure.
you don't want to allow it to be detached for very long because then it shortens, and then the surgeon can't reattach it. So,
Right. And so it was just, but they just said, look, we got this, but you need to go here. next."
Yes.
And they just sent him to the other spot, but they had stopped the bleeding. It was just right on the end of his thumb here, part of his nail. But and it was like, okay, but we're not the guys to really finish this. You need to go over here.
Correct.
But they did stop the bleeding and everything else, and that was cool. And they,
yeah.
And
Again,
and
it's
that
getting you
was-
stabilized so
right.
that you can go to where you need to be.
Right. And his insurance company was not happy. He went to go 2 places for one event, but
And then that becomes conversation when the insurance company is upset, and that takes getting the medical records to prove to the reason why you
Sure.
did that.
You'll get it straight, but it's not the issue. The issue is it'd be nice that he knew to go to the right place, and what saved him another 3 or 4 hours. And that's, those places are convenient, and it's great for hospitals to get customers, and as if they need more, but get their customers and things like that, and expand their reach. And I understand their businesses too.
Yes,
They
and
really
that's
are.
one of the reasons why concierge offices have really grown, because that is an availability of the physician, their nurse practitioner, and their office to be available 24/7 to help guide you. And that's one of the things that we do at our office is that we have different program levels for patients to consider so that we can help them. And again, not everybody needs that high level of one-on-one care. It might be something that, they're 20 years old, they're healthy, maybe they're 50 and they have, 3 different chronic illnesses that need more attention. So we have that availability to help direct.
Yeah, but it's nice because you knew all about them.
Yes.
You know all their past and everything
Been-
else. And you have all
and
their
I've
records
been doing
in
this
front
for
of
a
you, and
very
you've been
long
doing
time.
this.
Yes.
Well, not very long. You're not very old, but still.
25 years of doctoring.
But yeah, you started when you were 12.
I
but
started when I was
still.
14.
So that makes it, and also with video medicine, it makes it, that helps a lot.
Video medicine has been really wonderful. Just be able to see what is going on. You know, we've had patients that they're like, I have a rash, and they're like, man, it hurts, and I'm like, let me just take a look, and it would be shingles, and shingles can be very
Oh,
painful,
man.
and if not treated promptly, it can develop into neuropathy, which means the rash has gone away, the blisters have gone away, but the pain stays. So we want to get that under control very
Those are
quickly.
that's so scary.
And what's beautiful about the office is that we have some alternative therapies, which we can do ozone therapy, we can do laser therapy, and it actually stops the pain by 50% minimally within one treatment. So lots of options. And again, it's having a good relationship with your doctor, your internist, your medical group, and then finding out what places that you can go to should an emergency arise.
Absolutely. And it's going to save you money. Second thought.
Yes, and
That's even
what
better.
we'll do on our comments is we'll place the levels so that you just have the definition of level 1 through 5 and what that means, so that you can at least look at your pamphlets to know where you need to go.
Absolutely. Now, if anybody has any questions, info@everydayhealthhacker.com. Send us that, and I promise you, she'll answer every question, every single one.
Yeah, we hope that you will subscribe, comment below. If you have any favorite advocacy groups, please leave that in the comments. Have a
And
blessed day.
We appreciate you listening and watching.